Hello, everyone. My name is Rakira Washington, and I'm just going to be presenting my PowerPoint. The title of my PowerPoint is Helping to Improve Electronic Fetal Heart Rate Documentation. This is basically a goal to improve the documentation quality within the healthcare system as far as a labor and delivery nurse, and helping to improve the nurses' clinical judgment as well. The clinical problem and its purpose. Basically, the purpose of this is to help to enhance the communication amongst clinicians and providers by ensuring that the continuation of care is there and it's facilitated, allowing maternal and fetal decisions to be made appropriately. Also, it provides the documentation accuracy, and it helps to decrease the pressure related to workflow. And it's details as far as that. The project utilizes ADA methodology by creating a CDS far as basically providing an additional support for nurses to ensure that the documentation is completed accurately and effectively by using their ability of professional judgment. The goal is to improve the accuracy, the reliability, and the completeness of documentation as a whole within the labor and delivery world, far as improving the electronic fetal heart rate monitoring. And this could be through, again, communication, patient safety, and also this will provide the best quality of patient-centered care within this scope. Assessing or assess. In other words, we're defining the definition gap. Basically, clinicians or clinical assessment findings will help guide the content of the computer decision support system prompts, and it'll help to provide a timely manner of these prompts, basically by having audits, and whereas though people audit people's chart to make sure that they are accurately putting in the correct baseline, the variability of the strip, seeing if the strip has accelerations and decelerations, and making sure that the uterine contractions align with what is present on the strip, and not to mention seeing if the nurse is doing the correct interventions, which in turn will be basically seeing also if they have notified the provider in a timely manner on abnormal fetal heart rates and tracing. Also, frontline nurse, seeing their input, seeing what works, seeing the challenges, seeing the confusion, if they are confused, and what do they do in order to solve that. Basically being able to assess what times this is happening, and if it's redundant as far as the documentation. Lastly, focusing on the root cause. In other words, identifying the knowledge deficits, or being able to identify the individual systematic workflow challenges and the use of these issues. Design. Build support into existing workflow. In other words, this is basically showing the use and the principle of the testing by the frontline L&D nurses that will help eliminate the unnecessary clicks and avoid confusion and alert fatigue. Design principle is to support and not replace the nurse's judgment or clinical experience. So in other words, it's there to help support her. So this will happen by including the EHR standardized prompts as opposed to creating an additional documentation procedure. So helping to cut down on that. Also, it will help to basically help with the documentation and not cause incompleteness to the documentation. So it's just basically giving what is required. It will also include structured support far as categorizing the strips, far as like category 2, category 3. It'll show the interventions and if the provider was notified in the reassessment in doing those interventions. Also, this will help by using the technology far as allowing the education package included far as stimulations, teaching, competencies, and assessments, and being able to allow the labor and delivery nurse to provide feedback. Design. Basically, this is about the objectives for educational and competencies. 1, we'll use the CDS tool as accurately as possible and efficiently. 2, we'll apply the standardized fetal heart rate terminology when documenting and verbalizing strips. 3, we'll recognize documentation needed and the interventions for the category of strip far as 1, 2, and 3 patterns. 4, we'll improve the interdisciplinary communication. And 5, will increase compliance and effectiveness within the organization far as a documentation standardized assessment or education. Develop. Use case overview. Title: Using the clinical decision support system to improve documentation of electronic fetal heart rate monitoring and labor and delivery by improving use of electronic health records. The primary actor will be the registered nurse who works in the labor and delivery department. And also the trigger would be the patient coming into L&D and orders for continuous fetal heart monitoring. The supporting actors could be the OB provider, a midwife, a nurse educator, informatics specialist, RN manager, and also like anybody inside of the IT department or quality improvement department. The objective of this is to increase documentation accuracy and to basically have consistency when documenting while allowing clinicians to make their own decisions based off of clinical judgment and experience. Use case visual workflow. 1, we'll start off with the patient arriving to L&D for continuous monitoring. 2, the RN will conduct an initial assessment and the RN will document fetal heart tones in the EHR. 3, the CDS will evaluate if all areas are completed accurately and if the required fields are incomplete, prompting the RN to review this. 4, if the required fields have not been completed, no interventions will be necessary. Or 5, categorizing the tracing as far as category 2, category 3, documenting the interventions and notifying the provider as promptly as possible, and conducting reassessments. 6, following delivery finalize records for quality review purposes. And this is basically for being able to demonstrate alternative workflow during OB emergencies. It helps to provide priority of immediate patient care, and it helps to give you time to go back to document if need be. Also, the CDS can alert, should never interfere with the alerts during the emergency response. Success and failure criteria. Success would mean more completed documentation and is more consistent terminology, basically allowing the documentation to flow. It helps to improve interventions, notifications, and documentation, increasing the nurse satisfaction, and adhering to policies. Failure criteria is ongoing inconsistencies in the documentation, routine bypassing of the CDS prompts, and it's basically having alert fatigue or being overworked. No sustained improvements in compliance, and this is low satisfaction. Implement phase rollout. It starts by leadership approving and making policy reviews. Then it will go on to CDS build, integration and testing, and then we'll move forward to educator and super user preparation. Next, we'll have learning design amongst the staff, education, and simulation, testing, and competencies. Going to basically piloting this in real time support. And next, we have full implementation. Then we have ongoing audits and feedback. And a pilot is a way to minimize distribution and being able to make adjustments within the workflow quickly. Educators, informaticists, ITs, and super users will be able to do this in real time when it comes to implementation. Implementation of stakeholder roles. Leadership is defined and ensure that all policies are aligned to patient safety expectations. Information technology plus informatics is basically the development, testing, maintaining, and the redefine of rebuild CDS prompts and required fields. Education plus super users allows for educational training among simulations and competencies to go live. Learning development. Nurses utilize this during their workflow, and it helps to provide feedback and clinical judgment within the workflow. Quality improvement helps to document documentation outcomes and identify opportunities for quality improvement. Evaluate outcomes and usability measures. Documentation audits. This should more than likely happen the first 6 months. After that, we'll go to quarterly. It's basically identifying the elements of function within the fetal heart rate documentation system, including terminology, interventions, provider notifications, reassessments, assessments, and the policy compliance. Nurse competencies and experience. In other words, we'll ask the nurses about their comfortable level within the documentation, and if they don't feel comfortable, we'll help them to feel comfortable by giving them the necessary tools to help with documentation, help to ease them into it, by being useful and helpful to allow them to provide patient-centered care, and it should also help them to be satisfied during documenting patient care. Annual nurse competency validation, conducting nurse competencies annually. Ongoing quality improvement, and this is amongst leadership, educators, informaticists, and it will allow them to review the data that is identified in these areas where the tools are needed for revision, additional education, amongst that, and providing adjustments if need be to the workflow. Implications for nursing. Providing a better understanding of the health of both mother and fetus among healthcare disciplines by developing a common standardization within the mom and baby status. It helps to use CDS tools by decreasing missing pieces within the electronic medical record while allowing the nurse to make all clinical decisions. It is vital for the nurses to be involved in the design process in the use of testing to avoid using technology that will burden their workflow or put a damper on it. And auditing, providing feedback, using education, simulations, testing, and much more that will help the effectiveness by creating a practice amongst the education or training alone. Lastly, the project increases the competency level within the nursing informatics and enables the nurse to become an active partner in the digital transformation. Lastly, our conclusion, the path from the practical gap and change. First, we assessed, then we completed the design. Next, it was the development and the implementation, and then the evaluation. So the take-home message is basically that the CDS tool for electric fetal heart monitoring is a combination with the proper education, the proper training, and this is due to the simulation, the labs, and allowing the staff to engage within appropriate assessments by providing the structure and the effectiveness in order to evaluate the electronic fetal heart monitoring and providing the best documentation during clinical practice while also protecting the nurse's judgment. And then you have my reference page. Thank you, everybody, for watching my PowerPoint and also being able to listen to my presentation. Take care and have a good day.